when we talk about the importance of treating CINV, I'd really like to step back and really talk about the importance of preventing CINV. We certainly know from a lot of clinical trials, some case in other case series, that if you can prevent CINV from the beginning with first and all subsequent cycles, patients will have a much better treatment course. We know that certainly one of the most important risk factors as to whether patients will have an episode of CINV with their chemotherapy is how well they tolerated previous cycles. When we look at a patient and try to define what their risk is going to be before chemotherapy, we certainly take a number of factors into consideration. Generally, we divide these factors up into two big groups. First is the chemotherapy itself, or chemotherapy-related factors, and then patient-related factors. The chemotherapy-related factors are pretty self-explanatory. Each agent, each combination of agents has its own inherent risk to cause CINV. When we talk about patient-related factors, there are a number of those that we take into consideration. First, the patient, their age. Those under 50 tend to do worse than those older than 50. Males versus females. Females, for whatever reason, tend to tolerate chemotherapy a little less than males. How they handled previous cycles, as I already mentioned. Have they had any history of motion sickness or hyperemesis with pregnancy? Are they social drinkers, or do they tend to use alcohol regularly? Those that use alcohol regularly tend to tolerate chemotherapy, again, better than those that do not. And so we kind of factor all those in when we go to devise an antiemetic regimen prior to a patient's chemotherapy. We know that also if you can control CINV, their quality of life during chemotherapy and their treatment is much better. We also know that we can reduce hospitalizations, and that also reduces the economic burden on the healthcare system by keeping folks out of the hospital and not having complications due to their chemotherapy. Complications that we know that we can prevent with adequate antiemetics prior to their therapies.